My presentation is entitled Best Skincare Practice for the ELGAN Population. ELGAN is an acronym for Extremely Low Gestationally Aged Neonate. This includes infants ranging from 22 weeks gestation up to and including 27 weeks and 6 days. The question I am addressing with this project is whether or not barrier oils are effective compared to our current practice of using a petroleum-based barrier emollient, specifically Aquaphor. I looked at risk versus benefit of each type of barrier. Skin is the largest organ in the human body, and that includes the neonate. It serves as an important barrier and has many important functions. The main purposes are to serve as a barrier against external toxins and infections. It promotes tactile sensation, neurological development, insulation and fat storage, thermoregulation, as well as promoting water and electrolyte excretion. The outermost layer of skin, called the stratum corneum, starts to develop in utero around 15 weeks gestation and is not complete until the third trimester or around 35 weeks. It is considered like bricks and mortar, made up of keratinocytes and lipid. When mature, it is 10 to 20 layers thick. In extremely premature infants, it is only 2 to 3 layers thick. Infants born before the 30-week mark have a thin epidermis with fewer cell layers and impaired epidermal barrier function. Decreased presence of stratum corneum can result in heat dissipation and is visually notable by an overall ruddy and gelatinous appearance. An underdeveloped junction between the dermal and epidermal layer linked together by fibrils in preterm infants are weaker, fewer, more widely spaced, and have a decreased presence of collagen, which can lead to tissue edema caused by third spacing. Skin is less elastic and more likely to blister from friction. The pH of neonatal skin is also very neutral compared to the acid mantle found in pediatric or adult skin. The acid mantle is an endogenous process that occurs independently of gestational age and begins nearly immediately after delivery. Alkaline pH shifts can hinder skin's barrier function and result in transepidermal water loss. The nurse's primary role is to provide regular assessment of skin integrity and implement skin protocol as needed to provide effective treatment in order to prevent complications. The reason I chose this topic for my project is because there has been a lot of discussion recently about our current protocol and the fact that it might need to be updated to meet current evidence-based knowledge. Since extremely low birth weight infants are at high risk of developing nosocomial bacterial sepsis due to immature fragile skin, which can be an inadequate barrier to bacteria colonizing on the skin, this study was done to determine whether or not prophylactic use of an emollient would result in lower incidence of death and/or a nosocomial bacterial infection within the first 28 days of life. The study was conducted with infants weighing between 501 and 1,000 grams, and they were all less than 30 weeks gestation. 1,191 infants were randomized across 53 different neonatal units within the Vermont-Oxford network and were assigned randomly to receive generalized application of ointment twice per day for 14 days or local application of ointment only to injury sites, which is considered routine skincare. It was determined that prophylactic application of ointment did not lead to a higher death rate, but that the risk for nosocomial bacterial infection was significantly higher and warranted further study. A subgroup analysis by birth weight showed that this increased risk was only significant for the lower birth weight group, infants weighing between 501 to 750 grams. The organisms responsible in 82% of bacterial blood culture isolates were gram-positive, specifically coagulase-negative staphylococci. While this is an older study, it has been challenging to find current data on this topic. This next article is a detailed literature search of PubMed looking at risks of petroleum-based ointment and whether or not it increases the risk of coagulase negative staph infections in preterm infants. It helps to tie in the last article as it shows much more recent studies, including one done in 2018. The results of this search are very similar to the results of the previous study. It reiterates that multiple studies show an increased risk of sepsis with the application of petroleum ointment. In addition, one study done in Riyadh, Saudi Arabia, noted a substantial increase in the incidence of systemic candidiasis. This article goes on to state that the use of petroleum-based emollient oil mimics an environment similar to one seen with occlusive dressings. Aquaphor is also flammable, which cannot be ignored in an environment where oxygen therapy is in wide use. This next article is a randomized controlled trial to determine the feasibility, safety, and effects of topical coconut oil on the skin of very premature infants. Infants were all less than 30 weeks gestation and randomized into two groups. One group received 5 milliliters of oil twice daily for 21 days, starting at 24 hours after birth. The second group received no oil. Skin was assessed on days 1, 7, 14, and 21 using the neonatal skin condition score. There were no difference in common neonatal outcomes, including sepsis, necrotizing enterocolitis, retinopathy of prematurity, chronic lung disease, and mortality. This study simply showed that coconut oil maintained a better skin condition in very preterm infants without any adverse effects. It is simple, safe, and affordable, and it was noted that this intervention warrants further investigation. In this non-blinded randomized controlled clinical trial, two groups of 36 infants each were used. All infants weighed less than 2,000 grams and were between 28 to 37 weeks gestation with no anomalies or genetic abnormalities noted. The intervention group was given a massage with oil. The control group was given a massage without oil. 3 massage sessions were given each day, and each session lasted for 10 minutes. The massages were all done in the supine position, and specific techniques were followed. Weights for each group were recorded daily. At the end of the 6-month study, it was noted that the group receiving the coconut oil massage had a significantly higher weight gain than the group receiving no oil. This next article continues to explore the positive effects of coconut oil while looking at the effect it has on transepidermal water loss. In this study, infants were randomized into two groups of 37 infants each. The infant's mean birth weight was 1,188 grams and mean gestational age was 32 weeks. One group received twice daily coconut oil application without massage, and the other group received standard care. Transepidermal water loss was measured every 12 hours using an evaporometer until day 7 when skin swabs were obtained for bacterial growth and skin condition was assessed using a validated score. It was found that transepidermal water loss was significantly reduced in the group receiving the coconut oil and also had lower bacterial growth on the surface of the skin. This study is important because it takes the previous studies one step further and helps to explain why coconut oil is beneficial to the skin of ELGAN infants. The study was done to determine whether coconut oil is associated with a difference in plasma monolaurin levels. Monolaurin has a well-documented antimicrobial history and is the most abundant fatty acid in coconut oil. The data from this study showed that while monolaurin is a naturally present metabolite of neonatal plasma, it was demonstrated that the topical coconut oil application increases plasma levels of monolaurin. The concentration present in coconut oil applied topically is highly active against prototypical gram-positive late-onset sepsis pathogens such as S. epidermidis and S. aureus, as well as C. albicans. There was no observed activity against gram-negative bacteria. It was noted that the increased concentrations of monolaurin, both locally and systemically, can augment the total defense capacity of preterm infants. It was suggested that further study is warranted. This last article is a thorough systematic review and looks at all the effects of coconut oil in preterm infants. The end results of this review show that topical application of coconut oil can significantly reduce rates of transepidermal water loss, decrease rates of infections, including hospital-acquired bloodstream infections, can improve weight gain and skin condition, as well as decreasing incidence of late-onset sepsis. There were no significant adverse effects noted in any of the studies. My recommendation, based on all of the evidence that I have reviewed, is to discontinue the use of Aquaphor and implement the use of coconut oil. While I did find some evidence that Aquaphor can improve the skin's quality in this population, that was the only good effect I could find. The rest of the evidence was negative and even dangerous. All of the articles I found about coconut oil either showed no harm or some type of benefit or multiple benefits, some of them very significant benefits.